Well,
Oh, Sarvanji, you have to mute everybody, please.
that's something just now. Hold
Oh,
on.
okay.
Sorry.
Can hear the yogi saying good morning to everybody.
It's not letting mute. Yes, mute all, President. That's it. You can mute yourself, Dr. Kapur. You can mute yourself, Dr. Kapur. Happy Guru Purnima to everybody. कौन गुरु कौन चेला पता नहीं, हम सब गुरु हैं, सबके पोता पोती बेटा बेटी हो गया तो हम लोग सब गुरु भी है एक तरह से, है कि नहीं? Okay, you start now whenever you're ready.
नमस्कार एवरीबॉडी, आप सबको बहुत बहुत बधाई हो आज के गुरु पुण्य की. दिस इज द बेस्ट डे ऑफ आवर लाइफ, 13th of July. Lot of celebration going on in Haridwar. Our Guruji is there, Swami Ramdev Ji Maharaj, Acharya Balkrishan Ji, plus more. We are very lucky. We had a darshan in the morning. Thank you. Let's sit straight. Hands are in Dhyan Mudra. Into next step, spine straight, shoulder behind. Relax your body and the mind. You take a couple of deep breaths from the nostril at your own pace. Slow, deep breathing. Om. Guru Brahma, Guru Vishnu, Guru Devo Maheshwara, Guru Sakshat Param Brahm, Tasmai Shri Guruve Namah. सर्व मंगल मांगल्ये शिवे सर्वार्थ साधिके शरण्य त्र्यंबके गौरी नारायणी नमोस्तुते. नारायणी नमोस्तुते. नारायणी नमोस्तुते. ओम भूर्भुवः स्वाहा तत्सवितुर्वरेण्यं भर्गो देवस्य धीमहि धियो यो न प्रचोदयात्. ओम सर्वे भवन्तु सुखिनः, सर्वे सन्तु निरामयाः, सर्वे भद्राणि पश्यन्तु मा कश्चित् दुःख भाग् भवेत्. ओम शांति शांति शांति. Let's all start. Your topic is hypertension. Is it okay? Hypertension, the low blood pressure. How can we define? Because the blood pressure varies every second of the day. Some people are having this problem without realizing even, because they haven't got any symptoms. when the blood pressure, the normal blood pressure is 120/80 and 90/60, one can say that range. So when the low blood pressure happens, that means your blood pressure is lower than 90/60. Luckily, many people desire that blood pressure 90/60. But again, this is not uncommon. The people are suffering from low blood pressure without realizing. But when they start having symptoms, then they go to their GP and they are discovered as low blood pressure sufferer patient. And you know, this low blood pressure is more dangerous than high blood pressure, because this is quite serious. When it is very, very low, it can be life-threatening. So we all desire our blood pressure should be normal. And other thing is, this is very common at this golden age. There are so many reasons, which I will be touching again, the various types of low blood pressure and why people are suffering. There are so many symptoms even. Why we are suffering? The main cause is low immunity, anemia, dehydration, stress, as it is affecting every condition. Any disease we can say stress related. Then other things are, you know, which is not under our control. The endocrine system is not working properly. In that, you can say your thyroid gland, parathyroid gland is not functioning properly. You are underactive. That can give you even. And then again, these things happen many times when we have, you know, blood loss, like we have any injury, trauma, we lose a lot of blood, so you will be low blood pressure. Sometimes we get very severe infections, we can get low blood pressure, known as septicemia, that the blood is getting affected with the infection. Then sometimes it happens, you know, people have allergic reactions, severe allergic reaction, we call it anaphylaxis. Sometimes we have some injection, we are not sure, or some drugs we are taking which we are not sure, we can get allergy response. Then the blood pressure goes down. Then lack of various nutrients in our diet, vitamin B12 deficiency and folate deficiency, iron deficiency is giving us low blood pressure. This is very, very common, vitamin B12 deficiency, which leads to even anemia, very serious type of anemia, known as pernicious anemia. Unfortunately, this is very common in Asians who are vegetarian or vegan. So we should be very careful if we are getting symptoms of low blood pressure, which is multiple. Please consult your doctor and try to have supplement. We can't take any meat products, so we have to have injection. Most of us are having injection of vitamin B12 every 3 months. This is lifelong. You have to do it. And then other thing is the many medicine we are taking without realizing that they're giving us low blood pressure. Like diuretics, Lasix, that can give you. Then the treatment for the high blood pressure, people are taking so many, you know, drugs to lower the blood pressure. They're beta blockers, alpha and beta blockers they are taking. And this has happened with my husband even. He was hypertensive, he was taking these drugs and the blood pressure was normal. And it went down without realizing that he was still continuing with the medication. He went into coma, complete loss of consciousness. So these points are very important, please. That's why we say you check your own blood pressure. Doctor can't do it or nurse can't do it every day. So please buy your BP machine, very easy to do it. So please try to check your own blood pressure quite regularly. Now, depending upon the severity, you don't have to do every minute. Do it maybe once or twice in a day if it is very low. That goes even to hypertensive also, you know. We are supposed to check our own blood pressure with a nice machines you can get, and you can get the advice from your practice, which one to buy. So these drugs are also giving us, and other things are people are still very depressed. They are having antidepressive medicine. That is also giving us low blood pressure. And the person are suffering from Parkinson. They are getting some drugs which lower their blood pressure. So please keep check on all these things and not to suffer. In the young age, yes, pregnant woman is getting also low blood pressure. So these are very, very important points. We have to check all the time what we are doing, how we are doing. That is also very important. There are multiple symptoms for low blood pressure. In some people, there are not many, but in some where the blood pressure is very, very low, they are getting multiple symptoms. Very common is your dizziness, vertigo, lightheadedness. We feel very light. The other thing, we can't concentrate. You are talking to me, but I am not listening. Though my eyes are wide open, I am facing you, but nothing is going in this. That is known as inability to concentrate completely. Fainting. People are fainting. Some of us are fainted already. I am living example for that. Blurring of vision, nausea, feeling weak all the time, don't want to do anything. Even there is sleep disturbance also, you can't sleep. Insomnia, as we say. And those people, they are sleeping throughout the day, because they haven't slept at night. They are feeling so fatigued and tired. Wherever they sit, to go on sleeping. Headaches sometimes come. Other thing which is quite obvious, you can see a lot of paleness on their face, This is quite common. Sometimes people give us remarks that you look very pale. Better go and have your blood pressure checked. Confusion is there. Sometimes we are getting lots of us, especially people suffering with vitamin B12 deficiency, lot of numbness in our legs, in our hand, and some of us are getting stiff neck. So many symptoms. When there is extreme hypertension, then you are in the state of shock. What are the symptoms for that? Confusion, especially in the elderly. Skin is cold, damp, very pale. Rapid and superficial breathing, shallow breathing, rapid. And pulse is low and maybe fast. Many people with low blood pressure are suffering from arrhythmia, tachycardia. The heartbeat may be 160, 200. So please watch out for these symptoms. I had this problem. Tachycardia, and it was discovered because of the low blood pressure. But again, there's no medicine for this. No, they haven't produced. Only change your lifestyle and get better. Now, why this is happening? Our salt level is low. There's not enough water in the body. Dehydration. So simple technique. If you find someone is having these symptoms, give them salt plus sugar and this lemon juice in the warm water you can give. This will help them quickly to revive. Sometimes, people, some of us fast a lot. They don't realize they may be diabetic even. Pre-diabetic state, people don't know. And they do a lot of fasting. Then they get this low blood pressure and they're very irritable. They can't concentrate. So these points are very, very important. Let's keep in mind there are lots of symptoms. Now we want to get rid of the root of the problem is what is the cause. Let's say we can attack our thyroid gland first. Let's say my thyroid gland, parathyroid gland is not working. So I will be doing asana, pranayam, concentrating on that. So these can be helped. How can we easily help these problems? Very, very simple. Get rid of your stress. We know many techniques for that. Go on clapping whole day. Only conscious you have to keep in mind with the low blood pressure. Whatever movement you do with your body, do it very slowly. No jerks. No jerks. That is important. You can do many asanas, that is poses, and you can do all the pranayam, no problem, but focusing more on those steps which are going to help me, which I'll be touching soon. And say mudra is going to help us. There are so many mudras. And then coming to the acupressure point, I have put this picture in front of you. Please try to look at this. This picture is very important, the acupressure point. Now this is the Chinese people who are telling about the meridian, the energy points which we are touching, you know. So there are so many points you have to touch to get rid of this low blood pressure. Other thing is, I will start from the very early morning when you are leaving your bed, what to do. This is known as the postural hypotension. When you get up from your lying down position, sitting position, or standing, if you do this suddenly, blood pressure drops and you get symptoms. Dizziness, vertigo, lightheadedness, and you might fall. Why these elders are having more fall? Why? This is the reason. They get up so fast, they rush to their bathroom, and many people are dying in the bathroom. Some of my friends have gone, you know, they've gone to the bathroom and they're dead. So this is the reason, doing too fast. This is known as postural hypotension. So we have to be very careful in the morning when we get up, how to get up from the bed. Let's imagine I'm lying down in my bed. I want to get up now. I had enough sleep. I have to leave the bed. So what should you do? Do little bit gentle exercises in your bed. The upper arm and the lower arm, very, very gentle. That will increase your oxygen level, increasing more blood to the muscle and the ligaments and to various other our vital organs. So do gentle exercise. Anyone you can do. Rotate your feet or do like this, your toes and your fingers. Stretch, very, very gentle. Do in the bed. Yes, that will give you a lot of help. And then you sit up very gently. You are sitting, stay there maybe for half a minute. Don't rush, don't stand. Just stand now and go to your toilet. So this is very, very important to avoid. You know, 20% of our elderly population are suffering from postural hypertension. This is known as orthostatic also, orthostatic, when you stand, you know. Another thing you can do, please don't stand for a long time or don't sit for a long time. That will lower your blood pressure. Other thing which you can do very simple is, don't take too heavy meal. Take small portion more frequently throughout the day and chew it nicely. Chew it nicely. So these are the simple things one can do, you know. And other thing is, try to take little bit salt. Now, how much salt to take, you have to consult your physician. Don't overdo it, otherwise you will be hypertensive. So you have to ask your doctor. And other most important thing is, drink a lot of water. Especially the weather is so hot at the moment. Drink a lot of water. That will help us not to get this low blood pressure. So these are very, very important things which we are touching. And other thing is, now when you're bending down, you have to be careful. And other thing is, I will doing some poses also to show gentle physical exercise of any kind. You can do gentle walk. You can do jogging at a low pace, not like money, no. But very, very low pace, you have to do it. Low pace jogging. You can do swimming also. And other thing you can do on Surya Namaskar, no problem. You can do Surya Namaskar also. So these things we are doing every day. But again, that's what we say. Whosoever is doing the session, saying again and again, please follow your body, follow your body. This is what we are trying to say, you have to, what you are suffering. Keep in mind all these problems. And other thing is, try not to have too much tea and coffee. Though the research say taking 1 cup of black coffee in the morning helps you, the people suffering from low blood pressure, because it shoots up your blood pressure. We all feel that when we have tea or coffee, we get a little bit energetic. So, but don't have too much, and don't smoke and don't drink. Or you can cut down on that, like alcohol, you can cut down, but stop smoking completely. This is very, very important. Now, coming back to now, our protocol of our yoga. Yoga is a must for everyone, for any disease. For any disease anywhere, whether that is from your head up to your toes, any problem from your skin to internal organs, whatever the problem is, there's only one medicine, yoga and pranayama. And that added up with the mudra and acupressure, and maybe with Ayurvedic medicines also. So this is very, very important. Now, while sitting, we can do so many poses. Yes, but again, keep in mind, hypertensive, low blood pressure, severe acidity, severe asthma, severe backache, we do very gently, very gently. We don't push ourselves. So you do your gentle exercise, see, doing this, and I am doing my feet also at the same time. Carry on, gentle exercise, and you are doing your pranayama side by side, Bhatrika pranayama. Breathing from the nostril at your own pace, 2.5 seconds in and out, or maybe a little bit longer. This is all your diaphragmatic breathing. And a smile on your face. Simple exercise. I'm doing slowly. I am suffering from low blood pressure. But I want to do this exercise to get oxygen in the body. Then on the side you can do very, very slowly. Go on doing Bhatrika pranayama. Very good. Very good. Very good. Then you can take it up very gently. No rush. Down. Take it out, that side, bring it back. Low immunity is also one of the reasons. So many reasons why we got low immunity. So try to attack your thymus gland. This will increase my immunity, make me happy also. Very good. We are doing still some exercises going on. The leg also, you can raise your leg up gently, up and down, up and down. See?
Dr. Kapur, I'm going to interrupt. I have a special news to give you. Can I say just now?
Pardon?
I'm going to give you a special news. Today is Guru Purnima. Also today is Dr. Kapur's birthday as well. So happy birthday to
Mr. Kapur.
Huh? Oh, Mr.
Not,
Kapur, sorry.
not mine, it is Dr. Kapur's birthday today.
Okay,
Mr.
Dr. Kapur, okay, doesn't matter. So that's a
Yeah,
good
yeah,
news
yeah.
as well.
Happy
So really,
birthday,
good luck to all the best. I have to congratulate him, on his birthday. Have a lovely day for him. Please pass the message on to him from all of our group as well.
Okay, okay.
Thank you very much. I thought
Thank you very much. Yes, it's birthday today.
my pleasure. I always very high respect for him. Thank you very much. Only go with the class.
Are you going? Hello. So doing these exercises, all we do every day, gentle exercises. Carry on with a smile on your face. Other one you can do while sitting even. Raise your leg up, take your arms up and try to come down. Touch your toes like this. Paschimottanasana. Then you breathe in. Take it down. Other one you can do. Up there. Other one you do. Breathe in. Go up. Stretch. Stretch. Then breathe out. Now the hair movement is very, very gentle. I'm not doing fast. I'm very, very gentle. Go down. This is your Shachakasana. And come up very slowly. Stretch again. And take the arm by the side. Slowly, very slowly. Now cheer you up, do some tapping also here. There is a point, the acupressure point there. This goes from your ear, upper part, the finger joints here. And we do tapping. This take away all my anxiety because stress is there causing this low blood pressure. Activating my hypothalamus, anxiety, depression. Very good. Then do this area. This covers lots of our problems. The crease at your elbow with a smile. Other side. This is all your acupressure also going on. The other point which is picture is showing, we are touching our acupressure points. We have done this one. For low blood pressure, do the tip of your middle finger at the tip. Go on pressing, and now you can do Kapalbhati with this. Keeping in mind all the precautions, as we say. Now we are suffering from low blood pressure. So here we can do more times if we wish. Instead of doing 60 times per minute, that is 1 stroke, 1 second, we can do longer. Maybe 80 times, maybe 100 times. That will raise my blood pressure. That's what I want. Press this point and go on doing Kapalbhati. If you're pregnant or trying to get pregnant, please don't do it. If you're bleeding from anywhere, don't do Kapalbhati. After major surgery, don't do 4 to 6 months. Even after minor surgery, we don't do for a couple of weeks. And start doing on the instruction of yoga teacher or physician. Headache, severe headache, don't do it. Epilepsy, any fits, any convulsion, don't do it. So we have done this point at the tip of my middle finger. Other point is this area. No crease, wrist crease on this thumb side. Press this one. This is all Chinese, QI, the vital energy. In Japanese, in Chai, and we call it Pran Shakti, life force. Press this point, both the hands. to make my blood pressure go up. Very good. The another point is at your feet, this, you can see this point down here. Press this point. Very good. The next one is 4 fingers down your knee joint, coming here. Press this point on the shin. Press this point. 4 fingers down the knee joint, depending on the width of your finger. Press this point. Very good. Carry on with the Kapal Bharti. And do both the side together. Yes.
To go up.
Pardon?
To go up. Pressure.
I don't follow you. Please repeat. You're doing acupressure point for your low blood pressure.
Mine is
Dr.
high, that's
Kapur,
why.
if it is blood pressure,
Mine is
can you
high,
still
that's
do?
why. My blood pressure is high, that's
Excuse me, please. If you
If it's a
can't
blood
follow,
pressure-
ask me at the end of the session. Otherwise, I will forget about everything. Next is going back on your stomach. We all know. We do tapping here, don't we? This is very good for the weight reduction and if you go from your navel, 3 finger down, that is the point for the blood pressure. Press it hard. Press it hard. Especially if there's a lot of fat there, you have to dig it in and do your Kapal Bharti also. Other point, this is a sternomastoid muscle here, which is going behind your ear down to your collarbone. In midway, you press that point. And by doing this, you are activating your vagus nerve also, which will make you calm and cool. So press this point. So these are the points. Don't worry if you could not get it. This is all Chinese medicine. Just remember the simple one. This one. Tip of your middle finger. And normally in Swami Ramdev teaching, we say to get rid of the stress, we do this one, the ring finger. We want to get rid of stress because low blood pressure can be because I'm very stressed. So you can do this point also. We can add up our protocol in this, no problem. Because we are used to that more. The next point, as I mentioned in the beginning, sometimes there's a medical condition, we get low blood pressure like thyroid problem, parathyroid. So do your acupressure point for your thyroid. This is a big area, raised area, below the base of the thumb. Do this thyroid point. That will make my thyroid better and I will get better with the low blood pressure also. So carry on doing this with Kapal Bharti. As long you can do. Carry on. Okay, this point. Kapal Bharti. Let's do 20 times. At your own pace. And a smile on your face. Both the sides. Well done. Now we can do more things while standing even also. We are doing every day Tadasana. When you are standing on your toes. Breathe in. Go up. Put the hands on your head. Then raise it. Your arms up. You are standing on your forefoot. This is very good for the low blood pressure. Do at your own pace. Stay there for a short time. Then come down slowly. All the movements are slow. Breathe in. Up, hands on the head, then up again, stretching. Stretching. You are standing on your forefoot. Very good. Well done. Other one you can do is our Ushtang Asana. Half camel pose. Put your hands on your hip. Breathe in and take your head back. And breathe out and look straight. Very slowly you are coming up. Once again. Breathe in and go back. And breathe out and look straight. Next is Ardh Chandrasana. Like this. Breathe in and go back. And breathe out. By doing this asana, you're increasing the activity of your thyroid gland, parathyroid gland, even the vocal cords. And you are giving more blood to your brain. The next one is your squatting, which we do every day, squatting. You can do on the chair, you can do standing up, squatting. Gently, gently, very gently. And if you can go down more, if your knees allows you, you can go down like this. Your hips are coming out. Hips are coming out completely. See? Then you come up slowly. Again, breathe out from the nostril, going down. Then you come up. So these are the poses you are doing every day. But again, do it gently. Don't do it too fast. Problem occurs when we do it too fast. We feel giddy. You might have felt that. You might have felt that giddy sometime, when we are doing too fast. Please mute yourself. Someone is open, I think. Amrit. I can't do it. Many, you have to do it. Please mute. Thank you. So these are the poses we are doing, standing and sitting, I explained. There are some you can do while you are lying down also. The normal one we are doing, when we are lying down. We don't do the difficult ones. Very, very simple one. Again, lying down. You can just do lie down on your back. Just lie down. Now here I will put one cushion underneath my head. Yes. Take the right leg up, gently up, very slowly. Very slow. Up, 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 up. You can go up to 90 degrees, depending upon your practice. Otherwise, start from 30 degrees, 20 degrees, 40 degrees, 60, 70, 80, and 90. And try to stretch it. And hold it for short time. What is happening? You are increasing the circulation. All this venous blood is going back to my heart to get purified. We call it venous blood. This position is very, very important. And get rid of varicose veins, any aches and pains, and get rid of extra fat from the legs. Take it down. Other one, left leg is going up very slowly, 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 up. I am going 90 degree and stretch. See how much pressure is coming on my calf muscle. This is known as second heart. This is very good for lymphatic system, plus for the blood also. Blood, my venous blood is coming back from the veins towards my heart and get purified. Hold it like this for short time. You can do your japa inside. Om Guru Name, Om Guru Name, Om Guru Name, Om Guru Name. Then bring it down slowly. Next, if your body allows you, you're very flexible, you're doing these exercises, you can bring both the legs up very slowly, come up slowly, slowly, slowly. Hold it with your hand at the back of your knees. And if you're very flexible, you can take the legs down towards your head. That is known as Sarvangasana. Very good. Hold it, no rush. Then bring it down very, very slowly, very slowly. Very slowly. The next one you can do your Setu Bandhasana also, because the head will be going down, so that is good. Then your knees, bring it close to your hips and put the hand on the floor and lift up your spine, up as far you can do. Stay there for a short time. Setu Bandhasana. Then breathe out and bring your back down. The next you can do, join your feet, bend your knees. As you do for the butterfly pose, you join your feet. Let your knees rest on the ground. The thighs are also going down, and relax in this posture. That is very good for your hip, for your knees, and the circulation. Stay in this position for a short time. Again, you can do the mantra jap inside, whatever you practice. Today is Guru Purnima, so think of your Guru. Then relax. Well done. There's so many poses you can do. Other one is says, Padam Sarvangasana. I can't do it. Do Padamasan while lying down. I am doing just crossing. And your head is tilted back. Do like this, crossing your legs. So these are the easy you can do, you know. Well done. Now try to relax, go in the Shavasana. Take away all my stress. Relax your body and the mind. Keep a gap about 1.5 feet between your feet. Heel inside, 4 foot out. Arms are about 4 to 5 inches away from the body. Palm facing the ceiling. Take a couple of deep breaths in and out from the nostril. Think of your gurus, our teachers. Now try to visualize the whole body. You are visualizing, plus you are doing a little bit movement also. Look at your big toe, rest of the toes, the feet, the ankle joint, they're all relaxed. Coming to your calf muscles, they are well relaxed. Coming to your knees, they are well relaxed. Thigh muscles, all relaxed, no pain. Coming to your pelvis, the lower abdomen, all relaxed. Even the internal organs of my abdomen, they are well relaxed, they are functioning well. Chest, the lungs are working well relaxed. Try to feel the heartbeat. Concentrate on the heart. They call it mindful heart meditation. Mindful. Wherever we fix our mind, that is the mindful. Known as Dhyan in Ashtanga Yoga. This is your dharana and dhyan going on side by side. Coming to the neck, relax. On the face, the mouth, the nose, the eyes, the ears, they are all well relaxed. The forehead, the head.
And concentrate on the whole of your back. No problem. You're well relaxed. Coming to the upper arm, the fingers, the palm, the wrist, the forearm, elbow, upper arm, shoulder. No pain, all relaxed. Lie down and relax. Get rid of this low blood pressure. Take away all my stress, my worries, my anxiety, my fear. I am feeling light. I feel very secure. I am lying down the lap of my Mother Earth. Think of your gurus. Today is the best day. Guru Purnima. We are very lucky. Just go on floating. No swimming, just go on floating. As Ganga is going to join into Ganga Sagar, my Atma is going to join with Paramatma. That's what I want. My soul is going to join the super soul. Now raise your arms up slowly. Rub your palms. Put the palm on your eyes. Take the left bend. Bend your knees slightly. Put your hand underneath your head. Stay for a short time. Then you get up very slowly now. You don't want to suffer from postural hypertension. That's the idea. Do it slowly, not to get that giddiness feeling, fainting feeling, lightheadedness while getting up too fast. Thank you. Well done. This is by chance, this came in between, so enjoyed ourselves. Now the next one is acupressure points, which is very, very important. We have done many. Plenty we have done with our Kapal Bhati. Yes. The next one is, I'm sure you'll remember, don't worry about that Chinese one. Only remember this one or this one. These two. If you can't remember that area, doesn't matter. And press this one. Take away all the stress. Another thing what we do, take away our emotions. We are doing every day. Do like this. This is for the worry. You can do like this. Fear. Fear. I might get low blood pressure. This is for your anger. Why? Why I have got blood pressure low. Always getting annoyed. Take away all that. And this is for sadness, bereavement, feeling very low. Again, this is for emotion and for the mainly water problems, So all these are very important. We have to do every day. Can do like this also. Squeeze them nicely. So many benefits. Get rid of any pain in your fingers, in the thumb, like rheumatoid arthritis giving us a lot of problems. Pains, pins and needles. So these exercises, what they are doing, increasing the oxygen level in our blood, and we are getting better. So oxygen is the best medicine. That's why we do more pranayam to increase our oxygen level. You all know what is happening with the pranayam. 2 words, pran and ayam. Pran means this life force, ayam means controlling. First you expand and then you spread, extension. How to breathe is very, very important. People have learned and they are getting rid of many problems. Even from the stroke, they are recovering so fast. As soon as they get the sign of stroke, they just go on doing Alom Vilom Badrika for hours and they are getting better. Many of my friends have got better who are practicing yoga practice. So this is very important, pranayam. Just cool the mind, get rid of all the problems. Production of good hormones, the loving hormone even, oxytocin. That's why we are doing pranayam. And we spend a lot of time, maybe 80% time we spend on pranayam, rest, physical exercises and asanas. There is no other way. So we will cover more steps of pranayam even. And first we are going to do our mudras. Mudras are very, very important. They open up all the channel and the flow of the prana is going to the organ which needs. So how many you can do for your low blood pressure? There's plenty you can do. The first one I'll be doing Earth Mudra, Prithvi Mudra. This is very good to control our low blood pressure. So do Kapalbhati, please. At your own pace. The day is quite warm, so we won't be doing too much. The basic principle of yoga is you work out according to the weather and your physical and mental condition. When the days are very hot, don't do pranayam or yogic exercises too long. We have to do short time. And when weather is cold, like winter, we do longer time. So you regulate according to your physical, mental, and weather condition. So we are doing short time now. We will do short time. Prithvi Mudra is going to help me for my low blood pressure. Well done. Carry on. You are expert on mudras. Not do according to your condition, my dear. Hypertensive, do slowly. Hypo, low blood pressure can do fast little bit, but not too much on the room. You are responsible for your actions. Now change to now, Varun Mudra. As we are saying, we want to increase our water content of the body. So this mudra, Varun Devta, you know all that. Varun Devta, Jal ke Devta. Varun, touching the tip of your index, little finger, the tip of the thumb. Increase the water content. When we are dehydrated, we can get low blood pressure. And if it is very, very low, it is very life-threatening then. You can go into faint. You can even collapse. This has happened already. Nothing else was wrong with that lady. Only she wasn't drinking much water and she was fasting too much. Missing her breakfast. So regular meals are very, very important with low blood pressure. Don't skip any meal. Take small portion many times a day. Varun Mudra, giving enough water, give nice glow on the face, and all the systems work better. All the vital organs of the body, they work better when there is enough fluid. Varun Mudra. Varun Devta ki jai. हाँ, क्यों नहीं? जय तो सबकी करनी है, आज तो गुरुओं का दिन है. Carry on with the Varun Mudra. Next is Shunya Mudra. Shunya. The tip of the middle finger. The tip of the middle finger touching the base of the thumb. Thumb is resting at the middle finger. Shunya. This mudra is very, very important. Multiple benefits. A, it will increase your water contact with the body. B, for the ear problem, hearing problem, tinnitus, vertigo, this will help us. It's good for the throat also, because the area such we are touching. Good for the throat. So this is good for low blood pressure. Shunya Mudra. Do Kapal Bharti for a short time, not too long as the weather is hot. We have to be careful. We work with the weather. Shunya Mudra. Very good. Carry on with a smile on your face. You all look lovely. Shunya Mudra. Make sure the whole abdomen is moving, the upper part, middle, and the lower. Usually I say, put your hand like this and make sure the whole abdomen is moving. And you can check yourself, you are all expert, I know. Let's say you are doing a class 1 of you. So tell your student, put one hand here, feel the warm air coming out from the nostril. If the warm air is not coming out, that means it's not right technique. One hand across your tummy, like this, spread out. Make sure upper part, middle, and the lower. Because if you don't concentrate over there, maybe the one part is working, other one is getting nothing. So that part will be annoyed with us that I'm not getting the exercise there. So we have to do a fair deal with our tummy. Make sure whole abdomen is moving. Warm air is coming, yes. Okay, the next mudra is, Apan mudra, that raises the blood pressure. Apan, this one we do every day, isn't it? Now here I will be doing movement of the body very gently. Very gently. I'm doing my exercise side by side. If you are perfectly healthy, normal blood pressure, you can do fast. Yes, but if you are having low blood pressure, always encourage people to do some exercise, whatever condition they are suffering. If there is no movement in the body, they will never get better. Try to encourage them. Slowly and slowly you can move this movement. And this is going to help us. So many organs are getting activated. Look at my chest, my lungs, my heart, and then my waistline is also going better because I'm doing exercise very gentle. Very, very gentle today because we are having low blood pressure. Apan will help. Apan Vayu, that works other way around. The next one is your Linga Mudra. You can raise any thumb, right or left, doesn't matter, and do your Kapal Bharti. This is very good for the people who are suffering from low blood pressure. Good for the throat also, the vocal cords. Increase the heat, the body, People suffering from low blood pressure, they feel very cold, climmy. So increase the body temperature by doing this mudra with Kapal Bharti. If you can't do Kapal Bharti, doesn't matter, please. Slowly and slowly. Well done. The next one is actually the Pran Mudra. Pran Mudra is going to activate my prana. Nice flow of my prana. That's why we do, with most of the problems, we do Pran Mudra. Touching the tip of your ring finger and little finger, the tip of the thumb. And this is good for eyesight also. So many benefits with one action. Give a nice smile on the face. You are supposed to do all the 8 steps of pranayama and then concentrating on the special ones like Bhadrika, Kapal Bharti. We have to do for a long time. We want to raise our blood pressure. Then comes your, even the Bahiri pranayama. That will help you, but do it very gently. If you've got heart problem or severe hypertension, you don't do it. But here my blood pressure is low, so I can do. With the 3 locks we do Bahiri pranayama. The first one is known as Jalandhar Bandh, the neck lock, Udyan Bandh, and the Mool Bandh, which is down. We do it. We only do once. Sit straight, but do it gently. Breathe in, then breathe out fully, and make the first lock is your Mool Bandh, the basic one, the root one. Squeeze your stomach in. Just squeeze the muscle on your sitting bone. Just imagine you want to go to toilet and the phone is ringing. What we do, squeeze ourselves down below. This one is very, very important at this golden age. Take away all the urinary problems. Most of us are getting UTI, urinary tract infection plus prolapse. We are getting descent of our organ down, whether that is bladder, whether your cervix or uterus is coming down. For these things, this is very important, that lock. The root lock is very, very important for these problems, and same goes for your fecal incontinence. We can't control our bowel. This is all age related. Or it can be if you have any surgery down there and the damage is done there. So please try to do this every day, every day. You will see the benefit. And then the Dhyan Bandh going to activate all our internal organs for the diabetes and liver problem, constipation, urinary problem, and for the reproductive system also. That is going to help us. And this one is good for my thyroid gland, parathyroid gland, and the vocal cords. That's why these locks are very important. But always keep in mind all the precautions, please. So the next one is your Agni Kriya, same. Breathe in, breathe out fully, not force. Breathe out fully, no force, no. And then you go on bringing your stomach forward and backward at your own pace. But do it gently and do for a longer time. That will help you a lot with various other benefits. The next one you can do your Ujjayi also. As I mentioned, the medical condition here is my thyroid and parathyroid gland, they are not working. So I want to activate them. So we do Ujjayi pranayama, plus it's good for heart and lungs. Because why people are getting low blood pressure? Their heart is not working. What happens when we have heart attack? Blood pressure goes down, pulse goes down. That's what they touch. First thing they do, touch if there's any pulse or not, if there's any blood pressure or not. So heart is very important. And some people get this, in heart, their valves. The valves are not working. So heart condition is also one of the reasons of my low blood pressure. My heart is not functioning. The force of throwing the blood out, the pump of my heart is not working. That is known as ejection fracture. That is not right. That's very low. So that's why I want to activate my heart and lungs also by doing this pranayam, which we are doing always. So squeeze your neck muscle, breathe in from the nostril. Sound will come as a snoring sound from your vocal cords. They are constricted. Go on breathing, can't breathe anymore. Then you hold your breath. You can bring your chin close to the chest if there's no neck ache. Holding here. This is going to activate my thyroid gland, parathyroid gland. And when you do with the chin mudra, khichdi mudra, when you do with the khichdi mudra, there's extra benefit. Thyroid gets more active. Plus, you go in the stage of meditation also. Plus, your kundali jagran. All the shakti is coming from down up where we want. That's what is this doing, our Ujjayi pranayam. Hands are in any mudra. Breathe in after squeezing your neck muscles. Sometimes you can cough out. If you think there is a mucus in your throat, you can cough out and then start doing it. Put your hand here, you can feel. So all is coming from here, from the vocal cords. The next one is most important, Alom Vilom. Carry on. This is going to cover all my systems, alternate nostril breathing. Going to balance me completely. This will balance my blood pressure also. Make my heart better. People are getting better with their blockage of their coronary vessels, heart block. It is working as natural heart opening up, operation they do for that. So this is going to help us so much. Plus what is happening? Sometimes our blood pressure is low because of our nervous system, which is not working. Everybody knows about that autonomic nervous system, which is not properly working, and the people are suffering from low blood pressure. This usually happens in the young people, adults, they are getting this. And especially when they are standing for a long time. When they are standing for a long time, they are getting this low blood pressure. Now, other very important point about your low blood pressure is, if you are suffering from diabetes, many are suffering from diabetes. And when they take a heavy meal, they're not supposed to, they take it. And after 1 to 2 hours, they go into low blood pressure. That's why they say, don't take too heavy meal, and even after taking adequate amount of meal, try to sit for short time or lie down. Especially in the lunch time, they recommend either sit for short time or lie down for short time. Yes. And in the evening, they say after dinner, go for a very slow walk. That will make you better, make your muscles, ligament better, so that you can sleep better. After doing gentle walk, you are feeling much better. Now, as you are improving, then you can do your brisk walk, but always start with a slow and short time and then increase it. 5 minutes, 10 minutes, 15, go to 30 minutes. Every day we can do it. We are doing nothing. So we can do evening, maybe 20 to 30 minutes walk. But afternoon, you have to be a little bit careful. Okay, so this is very, very common. This is known as postprandial. Prandial means after eating. After eating, you are getting low blood pressure. Many people feel like that. And that's why they're sleepy also. They're very sleepy because the blood pressure has gone down. They want to sleep, and that's what is happening. But don't lie down for a long time, maybe 15 to 20 minutes, not more than half an hour. Don't sleep for 1 hour in the afternoon. So these points are very important. And the other thing is, you have to do what to do and what not to do when you're suffering from high blood pressure. As I mentioned about your postural hypertension, get up slowly from the sitting to the standing. We do in a rush. I don't know why. Always do in a rush. Take care when you leave your bed, as I explained in the beginning of the session, how to get up from your bed. And sometimes it helps you if you raise the head end of your bed, by using extra pillows or putting some bricks on the head side. And again, take frequent small meals. Check your salt content, how much salt you are taking, and increase the water taking also. So get rid of dehydration. Now what you are not supposed to do is, don't drink too much tea and coffee. That gives you dehydration. This is well known. The people we learned from here, anything happen, have a cup of tea. Have a cup of tea. But we all experience by taking too much tea, we are feeling very dry in our throat. That means lack of water in our body. So don't drink. Drink enough amount not to harm your blood pressure. Alcohol we don't drink. Smoking we don't do. So we are not worried. As I said, 1 cup of black coffee if you can take in the morning is good, or maybe tea, 1 cup in the morning, but never take empty stomach tea or coffee, I will say. Take something with it. And then, but normally we drink water when we get up, we have 2 or 3 glasses of water, and then we go to toilet, clear our bowels. So we don't drink tea. Maybe afterwards, maybe half an hour or 1 hour after, if you are used to tea, have your tea with something, any type of carbohydrate. Now coming back to your, what other things I can do? Change the lifestyle, as I mentioned already, with exercise, jogging, Surya Namaskar, and maybe swimming also. So what food I should eat not to get low blood pressure? Very, very important. We are targeting on the green leafy vegetable, on the lentils, beans. Try to take a lot of beans. But again, keep in mind, don't take too much of carbohydrate. The bread and the roti and whatnot. Cut down on that. But increase this because we need protein. And the green leafy vegetable we need is for our folate level, because that is also when the level is low, we get low blood pressure. So try to eat carrot, asparagus, they are very good, and all the green vegetables you can eat. And then take nuts also. That's what they're recommending when you're suffering from low blood pressure. Now, low blood pressure can be if you're diabetic and you have taken your medicine and you're gone out and you're not eating, your blood sugar will come down. So you will be hypo, which is giving all the symptoms of your low blood pressure. Pale of the skin, can't concentrate, you can get tremor even when you go hypo. Body temperature go down, you can't concentrate. So that's what they're recommending. Always take some nuts with you when you're going out in your purse. Or take something like sugar one, And there are so many things you can take with you. And the nuts are much better than anything else. We usually take, a lot of these biscuits full of trans fat, which is not good for us. So in the fruit, they recommend citrus fruit, like oranges. They are very good for low blood pressure. Then you can take even garlic. If you take garlic, that will help. The mulatti, licorice, mulatti is very good for the low blood pressure. And tulsi. Tulsi is very good. So try to chew 4 to 5 leaves of tulsi and maybe take a little bit juice of tulsi if you have tulsi. Our holy, that's Tulsi Maharani ki jai. Tulsi Maharani ki jai. Then other thing is, coming back to this figs, anjeer, and munakka, the big raisins, they are very good. You can soak them overnight and chew them in the morning, and the water you can drink. You have soaked these figs at night, or munakka, the big raisins. They are very good. Almonds are very good. And the milk, almond milk is very good. So you can soak your almonds at night, take away their skin and make a paste and take with the milk, or you can chew yourself and have milk. So these simple things we will be doing, to get rid of our low blood pressure. And again, in Ayurveda, there are so many medicines, Shilajit and Ashwagandha, which you can get here if you are suffering from low blood pressure. So there are so many things you can do to control your low blood pressure and be happy and cheerful. The laughter yoga, which is going to take away all my stress, make my heart better. I'm having low blood pressure because my heart is not functioning. That pump has worked properly to get rid of this low blood pressure. For my lungs and other activities are happening when we exercise, aerobic exercise is happening when we do laughter yoga. We do it every session. Okay, where are we? We have done Alom Vilom. Next to that is very, very important. Never miss that. Surya Vedi Namaskar, Pranayam. Surya Vedi Pranayam. I want to increase my blood pressure. So sit straight, relax your body and the mind. Close your left nostril. Breathe in from the right. Slowly. There shouldn't be any sound here. Slowly breathe in. Do at your own pace, 2.5 seconds in. Then you can hold, close both the nostrils, pause for comfortably, you can do, pause. And then you exhale from the left nostril. Surya Vedi Pranayam. Very, very important to increase my blood pressure. To increase my, blood pressure, and plus what is helping? My body temperature will go up. I am feeling very cold. I am hypertensive. So my body temperature will go up and my all organs will function properly. Once again, close the left nostril, breathe in from the right, soundless breathing, slow and deep breathing. You can do 2.5 seconds, 3 seconds, 4, 5 with the practice. The longer you do, more benefits will come. Then try to hold. In the beginning, you close the nostril,
When you practice it, you don't have to even close. You're just holding the breath. Then close the right nostril with the thumb and exhale from the left. Surya Vedic pranayama is very, very important to increase my blood pressure. The next one is Bhamri pranayama. This is again taking my stress away, increasing my immunity. We do 3 times. Breathing from the nostril, exhaling from the nostril, chanting the word Om 3 times. Next, Udgit Pranayam. Hands are in Dhyan Mudra. Take a long deep breath from the nostril, chanting the word Om from the mouth 3 times. Pranav Pranayam, the 8th step. We are in the seat of silent meditation. Fix your mind either on your breath or any chakra. Agya chakra, heart chakra, whatever, Manipur chakra. And we are chanting inside. Think of your gurus. Today is Guru Punya. It's a divine day. The gurus are always with us to guide us. They are always with us. That's why the gurus are called as Guru Brahma, Guru Vishnu, Guru Deva Maheshwara, Guru Sakshat Param Brahm, Tasme Shri Guru Ve Namah, Tasme Shri Guru Ve Namah. We are thankful to our gurus who guide us and give us strength to perform our duties. Thank you, thank you, thank you. Raise your arms up, rub your palms. Put the palm on your eyes. Feel the warmth of urja going to your face, your eyes, to increase my vision. Slowly open your eyes, remove the hand and take it to any area where you need. The next day you can do your Singhasan very gently, very gently.
Okay, I will summarize this. Doing this, whatever we have done, you have seen all. This is Triveni Sangam. We are adding up everything. Our asana, we have done asana, yes. Pranayam, and then dhyan. I wish we have more time for our dhyan and meditation, but usually it's not practicable in these sessions. So try to do more meditation to take away the stress. So this is what I have to offer you today. If you have any question, you are welcome. Thank you very much. Sarve bhavantu sukhina, sarve santu niramaya, sarve bhadrani pashantu, ma dukh bhag bhavet. Om purnamida purnamidam punyat purnamudhyate purnasya purnamadaya purnameva vishishyate. Hari Om Tat Sat, Hari Om Tat Sat, Hari Om Tat Sat. Om Shanti,
Shanti.
Shanti, Shanti.
Can add something on to that? Today is Guru Purnima. सबसे पहला गुरु आपके माता पिता हैं.
जी.
पिता से आप संघर्ष सीखते हैं, माता से संस्कार सीखते हैं. देन आपके आते हैं स्कूल के टीचर, गुरु, और जो भी आपको सो शिक्षा देते हैं, और जो कमी होती है वो दुनिया सिखा देती है. लेकिन that's the story of the whole life. You are learning all the time. कौन गुरु कौन चेला पता नहीं. हम लोग सब में एक गुरुपन है. हम लोग सब गुरु हैं, सब चेला भी हैं. है कि नहीं? Lovely session. Thank you very much, Dr. Kapur. And just you can start do the laughter class once more just to finish off. Laughter is the best form of exercise, isn't it? Give me a big laughter. Thank you, everyone. Any question you can ask now. If you have any question you have to ask Dr. Kapur, you can do that just now. Anybody wants to put the hand up, I can mute yourself one at a time, please.
मुझे पूछना है कि लो प्रेशर हो जाता तो क्या कर सकते हैं?
ले भैया,
वही तो सिखा रही थी.
लो ब्लड प्रेशर हो जाता तो क्या करना चाहिए?
अच्छा क्या करना है? There are some tricks you can do. Very good question. Suddenly low हो गया है.
आप हिंदी में बताना.
Some nuts with you.
हिंदी बोलिए, हिंदी में बोलिए डॉक्टर कपूर.
हिंदी बोलिए प्लीज डॉक्टर कपूर.
Listen, हिंदी में बोल लूं? Okay.
Yes please.
पंजाबी तो नहीं चाहिए.
पंजाबी भी समझ जाएगी. पंजाबी भी बोलो तो समझ जाएगी.
देखो, अगर आपको सडनली लो ब्लड प्रेशर हुआ है, अगर आपने खाना नहीं खाया, ब्रेकफास्ट ना खाए, बाहर चली गई अपनी सहेली के पास, तो उसमें ये कुछ खाओ जल्दी से. कुछ ट्राई टू टेक समथिंग सॉल्टिश, जैसे क्रीम क्रैकर होते हैं ना, मैं तो वो रखती हूँ अपने साथ. थोड़ा चीज रख लो. चीज, कॉटेज चीज इज वेरी गुड. अदर चीज, चेडर चीज वेरी गुड. लिटिल पीस, नॉट टू मच. वो लो, उससे ठीक होता है कि नहीं. अदर ट्रिक्स यू कैन डू, you know, try to stretch yourself like this. Do like this. Strength, that will improve your blood pressure. अपने fingers, अपने toes को काफी stiff रखो. अच्छा, दूसरी चीज, you can cross your legs and the arms. That will help you. Do both.
सवन जी बताते रहो.
Cross. This is the tricks of. Other thing is squatting. Just squat and see your blood pressure will come up.
Okay. Every day morning हो जाता है डॉक्टर कपूर?
होता है मॉर्निंग में. क्यों होता है मॉर्निंग में?
पता नहीं, थोड़ा से
जब
ऊपर
हम
जाती
सो रहे होते हैं, हमारा ब्लड प्रेशर लो होता है, और अर्ली आवर्स ट्राई टू गो अप लिटिल बिट. इसीलिए कहा कि बेड आपने कैसे छोड़ना है अपना बेड. थोड़ी एक्सरसाइज करनी है, जेंटल लाइट स्ट्रेचिंग एक्सरसाइज अपने बेड में. Then you get up very slowly. Take maybe 30 seconds, 40 seconds, 1 minute. Sit up. Sit there for half a minute. Sit there. Your legs are down. You are sitting at the edge of your bed. And then after 1 minute, you get up very, very slowly. And if you feel you're
Dr.
fit to
Kapur.
walk to your bathroom, go.
Just hold on.
This will help
Dr.
you.
Kapur, you said about low blood pressure, but I always have the high blood
No,
pressure.
let's talk about
We
one
have
thing at a
covered
time.
last section, my dear.
This is today we're covering this low
High
blood
blood
pressure. Low
पहले
blood
मेरा
pressure में
खत्म करो।
low blood pressure में क्या करना है रामा जी? आप है ना कपाल भात बेड में जो उठने के पहले बेड में सोए हुए हैं ना, कपाल भाती कीजिए लिंग मुद्रा में faster. That itself will bring the blood pressure back to normal as well.
Yeah.
And also Silajit Rasayan will help you as well. If you
वो
take that
खाना
daily.
खाने की बात ठीक हो जाती सवन जी।
हाँ नहीं भाई खाना कमी से होता है रात में डिटॉक्स आप रात को खाना देर से मतलब जल्दी खाया होगा रात को थोड़ा देर से खाना खाएं मतलब जैसे आप मोर लेस 3 घंटा पहले सोने के तो हेल्प करेगा your body has no energy left that's what Dr. Kapur was saying if you have low blood pressure you have to eat something if you're hungry
Yeah, eat something. This is very common. Very
that's
common.
right very common
Oh, thank you.
That's why they
Thank you,
don't do
Sawan
too
ji.
much fasting.
Thank you,
Just भजन
Dr.
करो,
Kapur.
fasting की तो जरूरत नहीं अब भजन करो और सेवा करो बस।
अब बहुत हल्का है थोड़ा वेट बढ़ाना पड़ेगा आपका ठीक हो जाएगा
अच्छा going
अभी
back to
मेरी
आपके
डायबिटीज
हाई ब्लड
काफी कम
प्रेशर की
हो गई
बात जो
सवन
थी
जी।
जो
डायबिटीज
मैंने
बहुत
बताया
कम
उसका
हो गया।
उल्टा करना है आपने बस सॉल्ट नहीं लेना पोटाशियम ज्यादा लेना है
that's right
बनाना ज्यादा खाने हैं
बनाना खाओ टमाटर खाओ
हाँ,
ये सब खाओ फायदा
और
करेगा
ये सब खाओ खाने में जो आज बताया आपको उसको उल्टा कर दो
नमक कम खाओ नमक कम खाओ
वैसे हमने कवर किया है ये सब्जेक्ट अगर आप चाहो तो मैं दोबारा भी आ सकती हूँ नो प्रॉब्लम
Yeah,
पर इस
welcome.
समय सारा एक्सप्लेन करना मुश्किल है
Is there a recording for this?
बहुत
Yes,
अच्छा है।
yes. We have a recording
Dr.
इसका, yeah.
Kapur, Dr. Sawan
I'll
ji.
put that on YouTube and also in the Facebook as well. It's on the Facebook live just now anyway. Also, it'll go on YouTube as well later on.
हाँ आपने रिकॉर्डिंग की थी ना हाइपरटेंशन
Yeah, हाँ क्या था?
हाँ तो वो देखिए आप नहीं तो कोई बात नहीं जब कहोगे हम दोबारा आ जाएंगे हम तो आपकी सेवा में बैठे हैं
नहीं हमने recording कर
बाहर ही
लिया
नहीं
है
जाते
इसको YouTube में डाल देंगे और plus it's also on the Facebook as well. So you can share it with people like-minded people who जिनको जरूरत है यूज कर सकते हैं. Today I'm going to take class this evening, but it's been cancelled because of the group Purnima program happening as well. So you're taking, so I've cancelled that. So next week I'll talk about high blood pressure. लगता है डॉक्टर कपूर को लो ब्लड प्रेशर है इसलिए उसमें इंटरेस्ट ज्यादा दिखाया हम हाई ब्लड प्रेशर पर बात करेंगे जैसे मानी जी को लो ब्लड प्रेशर है ना हमको थोड़ा हाई ब्लड प्रेशर है तो I'll talk about high blood pressure.
Dr. Kapur, I had an experience getting up very quickly from the bed.
Yeah, बोलिए.
And I felt very, very dizzy. So I had to, sit down and sit down and then lie down again. And then I have to get, like I said, I have to do a bit of my movement. Then slowly sat up in the bed and then I turned back and sat at the edge of the bed. And then slowly, I got, when I feel better, I had a drink of water as well. We do a lot of nurses because we are very, very busy sometimes. We don't have enough time to drink, and we work in a very hot environment in our unit, so we do feel that dizziness. And across my fingers, I haven't fainted, but I have felt dizzy, and I sat down and I drank plenty of water. But there have been a lot of nurses who just fainted, and we have to
But I think that's more due to dehydration as well, because not drinking enough water.
I've been drinking a lot, we do drink in between, but when we are very, very busy, we don't have time to drink either.
yeah.
That's what happens in school children. They don't drink enough, they fall asleep in the class. And then they have a lot of constipation. They have a lot of constipation as well. Because blood is made up of 90% water. With lack of water, and the blood becomes thick, so it doesn't move properly, and the blood pressure kind of, goes it's all domino effect, isn't it?
Well, at the moment, my blood pressure is stable.
No, I'm just talking general. I'm talking general, not just that's my understanding. I'm not a doctor, but at the same time, what I've learned from.
That's why I don't do a lot of fasting as well. Fasting also
Doesn't help.
Also,
Very
with
nice
blood
class.
pressure,
Sudarshan very nice class. Lovely class.
yes.
very good, very
I
good.
joined
Dr. Kapur,
Naveen,
.com.
thank you, Sudarshan Naveen.
Thank
Very
you,
nice.
thank you, welcome.
Very nice, very nice.
Thank you, everybody. Enjoy the class. That was excellent. Well done, Dr. Kapur. अब सबको ज्वाइन किए, आप लोग के चलते ही क्लास चल रहा है, आप लोग ज्वाइन करें तो कुछ क्लास ही बंद हो जाएगा।
अच्छा
इसलिए
लगता है।
आप तो thank तो सबको अपने 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 कंधा थपथप होगी। नहीं तो
Dr.
Can
और
I
लोग
ask
बोलेंगे
you a question?
Last thing, when you did the Surya Mudra, you breathe in and out from the right nostril, and then at the end you take it out from the left.
yeah, from the left.
Yes, yes.
Okay.
So what you do, you breathe
Yes.
from right, you hold the breath for a few seconds, and then breathe out from right and left. And then
Yeah.
you start the process again back and forward. That itself will be able to raise your blood pressure back
So
to normal.
you take a longer breath from the right.
That's it. Yeah. And then you do the opposite. If you have high blood pressure, then you breathe from left.
Yeah.
And you hold it and take out the other side.
I was taking in and out from the right, and at the end she did it from the left. Okay.
But also in this case, also I said to one of the class was, if you put the cotton bud on your left ear, the right nostril becomes predominant. That itself will help to raise your blood pressure if you have low blood pressure.
Yes,
in
I
daily
remember
life.
that. Yeah.
That's one of the, because it heats the body up as well. And also you have to eat more food which heats you up, because the low blood pressure people tend to be more travel sickness. They more, when you go to the high mountain, they get travel sickness as well, altitude high sickness as well, and all that. That's part of the symptom.
Yeah.
Yes, right.
Dr.
Dr.
Kapur.
Kapur, can I ask you one question?
Yes, you can.
Okay. Doc, I just wanted to know, next time, sometime, if you got time, you can do the class of palpitations?
What's that?
The heart palpitations.
Arrhythmia. Arrhythmia.
Yeah, they're called atrial fibrillations or something. AF.
Big name.
The arrhythmia is such a common problem, you know, that involves many medical conditions.
Okay.
Yes. So you want to cover that, arrhythmia?
Yes.
What was that?
If you
Is that
can explain
palpitation?
a little bit better sometime, if you
What's the,
got time.
what's the
please.
symptom of that?
Okay, no problem.
Dr. Kapur, what's the symptom of
Something
that?
to do with palpitations?
Yes.
That is same, you know, palpitation.
That's why, okay. I understand the English language. I don't understand the medical term. Palpitation, I know.
दिल का धड़कना बहुत ज्यादा
हो जाता है कभी कभी
दिल की
इसके
धड़कन
लिए
बंद ना होए
स्वामी जी देते हैं अर्जुन का छाल।
मैं आपको ये भजन सुना दूंगी इसके ऊपर है
स्वामी जी
दिल
खिलाते
की
हैं।
धड़कन दिल की धड़कन 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 दिल की धड़कन रुक ना जाए नाम तेरा लेते नाम तेरा लेते दिल की धड़कन 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 ओ रुक ही जाए नाम तेरा लेते ओ नाम तेरा लेते
Very good, Dr. Kapur.
कृपा करो ऐसे महाराज